Minfy and AWS present AIM 2023 in association with CNBC TV 18.
Good evening, ladies and gentlemen, and welcome to AIM 2023, where we're trying to envision an AI-enabled integrated healthcare ecosystem. Well, India is well poised today in the world to innovate and deliver comprehensive healthcare solutions that can really benefit humanity at large. We have a potent combination of traditional Indian wisdom through Ayush, continuous innovation in modern medicine, and the power of emerging technologies like artificial intelligence. In fact, AI is the enabling glue when it comes to convergence of different fields of medicine, improving operational efficiencies of healthcare providers, reducing treatment time, and of course, offering very, very high quality patient care. So to discuss all of this and more about what an AI-enabled healthcare ecosystem actually entails, I have Rajiv and Vikram here with me. And thank you, gentlemen, for joining us here today. Rajiv, if I may begin with you, I know you're a qualified mechanical engineer. You've spent significant time in technology. You've headed Motorola in India. You've worked with ISRO. And now, of course, you are known as a pioneer in the integrative medicine field, having founded AyurVAID hospitals in 2005. Give us a sense first of what do you mean when you say integrative medicine, because there are many, many definitions of that out there.
It's a pleasure to be here and with Vikram and Mridu, and thanks to Minfy, AWS, and CNBC for inviting me. But before I answer that question, I just wanted to say I'm the first speaker after the Galaxy or 6 or 7 startups who came and presented the solutions. And frankly, I was quite taken aback by the range of solutions that was presented. And some of them, without naming them, because we'll wait for the evening awards to happen, were quite spellbinding. I was so impressed. So first of all, my compliments to all those who presented here today.
Round of applause on that, please.
Now, this word integrative medicine and integrated healthcare, these are words which are used interchangeably. And we need to probably place it in context as we look at the problem of data, big data, AI, and so on. So it is not unrelated to the topic at hand. So when you look at integrative medicine or healthcare, we are talking about the classical definition is conventional medicine complemented by other systems of medicine in the patient's best interest. This is the primary definition. But what are the other tenets of such a model? Is the patient is a co-participant in the process of healthcare. It sounds quite fundamental, but it is not just a provider, service provider, and a dumb recipient of the service. So he's an active participant. The other thing which really comes through is body, mind, spirit, community health, going beyond the individual physical body. Again, data is very high the moment you analyze a problem like this. We could see some examples in the previous session. Third part, going beyond body, mind, spirit, we are talking about continuity of care. We are talking about going beyond transactional one-time interaction to a lifetime health management paradigm, right? And ideally, we are going to personalized care, not the personalized medicine which is purely tech-driven, but which is patient-centric. So when you look at integrative medicine, the values which it presents is truly in the best interest of a patient. To contrast it with integrated healthcare, we're talking about multiple healthcare providers coming together to serve a patient. So these are subtle points, but used interchangeably. But I also want to bring in a third dimension, which is when you look at integrated healthcare, we're also talking about the government. We're talking about the government infrastructure today with tech and internet completely pervading the service industry, right? And every citizen empowered with that. We're talking about integration where we are talking about seamless delivery across multiple platforms. So I see all these dimensions coming in with it.
Right. So great to hear some of those nuances there. And I want to pick up on that bit you spoke about, how there is a focus on a lifetime of care and, better care, more personalized care. Today, there is a huge focus on diet, on lifestyle, on gut microbes, metabolism, epigenetics. In fact, in 2017, the Nobel Prize in the field of medicine went to circadian clocks, which yoga has been talking about for hundreds of years now. So can you give us some examples of what modern medicine is now discovering, which actually is not entirely new to traditional Indian wisdom, and how you see this panning out in the future?
In fact, there's quite a lot to share in this particular, to respond to this question. But quickly, a couple of points to tell you. Between 1998 and 2007, the European Union carried out a fairly extensive study of 15,000 women across the European Union. At the end of that study, very systematic study, long-term study, they realized that women with menstrual disorders in their teens, right, had a higher possibility of getting PCOD and, diabetes. So if you go back to Sushruta Samhita, right, which goes to about 600 BC, there's a very clear definition. I'll just tell you, it's not just anecdotal or whatever. Sushruta at that time did say that only males would get prameha or diabetes or madhumeha, right? Females were excluded. You see that because the view was that due to certain physiological processes, women were excluded from that particular disease pathology. We fast forward, today we see very clearly that the study is showing exactly the same thing. You look at epigenetics, epigenome. 80% of the health and pathogenesis which happens status in a person is predicted by the epigenome and not just the genome of the person, which means the influence of the environment, influence of diet, lifestyle, mental factors, not just the genes. So how do I really model all of this? Ayurveda has talked about this in terms of dinacharya, ritucharya. We talk about circadian rhythm, which is basically the daily pattern. These were told long time back. As we go into many such points, you see a tremendous correlation. I would want to connect the two by telling the wisdom of Ayurveda. Time tested. You take diabetes, and this is the key part. I don't know how many people are aware of the fact that if I'm diagnosed today with diabetes, 7 to 10 years prior to that, my metabolism, my insulin resistance would have peaked 7 to 10 years prior to me being diagnosed today. All throughout this period, if I were to go and check my biomarkers, right, barring the point when I come to a pre-diabetes stage, when my HbA1c would be designated between 5.7% to 6.5% or 100 to 125 mg per dl fasting blood sugar, I would still assume that I'm perfectly healthy. But Ayurveda gives us about 40 physiological, physical parameters, right? I'll conclude with this point. We have in Ayurveda 20 types of prameha, out of which 4 types of madhumeha, which are 4 excessive urination, which is one of the first cardinal signs of diabetes, and 4 of them correspond directly with type 2 diabetes. And so the entire pathogenesis process from pre-diabetes to onset of proper diabetes to diabetic complications. So the beauty is we can collaborate.
Right. Very rightly and aptly put there, we can collaborate. And Vikram, if I may come to you, AI is the glue that can bring all of these practices together. We've seen the rise of things like telemedicine, things like robotic surgeries, a lot of transformation in the healthcare space just within the last, say, decade or so. At Minfy, what is your long-term vision when it comes to enabling AI integrated healthcare in the ecosystem?
First step, I think I just want to clarify here, all the presentations being done, all the healthcare life sciences experts being in the room. At Minfy, at the core, we really believe in co-innovation. We have a team of experts who are data scientists, data engineers, machine learning engineers, AI experts, cloud. Those are the experts we have. We also have doctors and healthcare life sciences experts who can actually interpret the language between actually the practitioners and the policymakers. So if we really talk about some of the use cases, I'll just count maybe just top 3 use cases here. One of them, biggest challenge which we have solved, just throwing in these capability of AI data, is for a large problem which we showcase about the chronic kidney disease. 12 to 15% of Indians actually have chronic kidney disease. That goes undiagnosed. It's a very expensive treatment. We partnered with an organization called Mahavir Hospitals. It's based in Hyderabad. They actually do charity, and they actually provide dialysis for chronic kidney disease patients at 200 rupees. And this is actually 1/10 of the price which normally is available in the market. Using AI and data analytics, we are now able to really look at the supply as well as the demand and really predict what are the kind of patients who will actually need the dialysis. So that's one big use case. Yeah. Second, we have really worked with a very large Fortune 500 life sciences company which deals with oncology and for the lung cancer. And they are able to sort of do a very big profiling of genome sequencing on genetics and also look at epigenetics, what Rajiv just spoke about, and multiple lab tests and a conversation between a doctor and a patient. And putting all of that data together, they are able to actually come back and say if the drug is going to be really relevant and applicable for that kind of a profile of a patient and really save lives. Having said this, for drug discovery, for hospital treatment, I think the big focus, for all of us is to how do we really do prevention. And there we have again partnered with AyurVAID company. We spoke about Ayur.ai, where we can actually really preempt, Rajiv, what you just spoke about almost 7 to 10 years earlier. Of course, not maybe that much earlier, but can we really prevent diabetes with the metabolism, with the profile which we can really understand, and with the therapies which we can give so that we don't even reach a stage of dialysis. So it's basically the collaboration with the practitioners here.
Right, and collaboration is, I think, at the heart of everything that we are talking here today. Rajiv, there is often a disconnect when it comes to, modern medicine researchers and practitioners of traditional medicine. But is there a way in which that, instead of fostering this division, we actually bring people together, we bring practitioners together, and really can a common language be established so that they find it easier to collaborate with each other?
So that's a very important point, I think, as we move on this path of trying to make India a preeminent healthcare player globally. So when you look at the so-called chasm between modern healthcare and Ayurveda, it is created and it can be bridged only through a joint effort. And why I mention this, it's not just about, east is east and west is west and the twain shall not meet. It's about Ayurveda communicating what it does, the paradigm in which it treats, in a language and terminology with evidence to their counterparts. The good thing which I should share with you, if you look at the continuum of healthcare from primal prevention, primary prevention, secondary prevention, emergency care and tertiary prevention, the complete continuum. We had somebody speak on similar lines earlier. What happens is the two need not compete at all. Each have a role to play in different stages of disease and different diseases particularly. So I'll give you, for example, we operate in 3 of the top quaternary care hospitals in Medanta, in Sri Shankara Cancer Hospital, a 500-bed cancer hospital in Bangalore, Aster CMI in Bangalore. What we do, for example, in Aster CMI is road traffic accidents, patients who are extremely, they're vulnerable, suffering from quadriparesis. We manage them through an integrative protocol. You can see enough papers and evidence, I can show that. How specialists from neurosurgery, from physiatry, Ayurveda work together to restore health. So we put it this way, in this particular use case, modern medicine keeps the patient alive, Ayurveda restores health. On the other hand, look at adjuvant care in cancer. Chemotherapy patients who are suffering from hair loss, breast cancer patients, other kinds of side effects, right? From mucositis, constipation, loss of hair, burns, everything. These completely allied issues which we suffer when I go through the primary pathway of care. Ayurveda can play a very, very supportive role. We have 3 clinical trials with partners there to look at conditions like trismus, right, in head and neck surgery, sensory neuro hearing loss. So this is the beauty. It can happen only when we make efforts. We take defined problems, for example, in seizures or in Parkinson's, very good complementary role. So we take these cases and we bridge. I'll just conclude by telling the patient-centric healthcare record, once you go with it, Ayurveda looks at the whole person. Modern medicine goes in very deep at nano, micro level, at system level. Ayurveda at a whole person level, there is no contradiction. We have a whole person medical record. And we today, in the hospitals we work, have one EMR in which we enter our data, the other specialists enter. It's a unified medical record. Absolutely no contradiction or dichotomy. Thank you.
That's wonderful, and actually it's great to hear the efforts that are being made in this direction. Vikram, I want to ask you, how can AI and large language models, particularly those being used in generative AI now, how can these contribute to this common language that Rajiv was just talking about? And as we envision the future, what are some scenarios that, perhaps we think are unthinkable right now, but we may see happen in our lifetimes as far as healthcare is concerned?
Yeah. I think somebody just spoke about Black Mirror. I think we have a very positive outlook. We at Minfy think about a golden mirror, and we think about possibilities which are really maybe not imaginable today. One of the big ones we hear feedback from hospitals is from emergency response teams. And there is loss of lives. There are examples where specifically one of them is pulmonary embolism, which leads to sort of cardiac arrest. And those are the signs where there is a probability. A lot of lives are sort of lost today. We really believe in that setting, there could be a faster diagnosis and we can save lives in our, in our lifetimes very, very soon. That's one of them. I think the second big example which we just saw is a divide between sort of the urban and sort of rural area, between the rich and the poor. And I think that we are going to see a big, big change. I think we are all familiar with the telemedicine, but we'll be able to see virtual ICUs. We'll be able to see, we talked about Ghar Pe diagnostics today, but we'll be able to see Ghar Pe ICUs in rural area in our next to 10 to 20 years itself. And one very large, interesting area which is really we are fond of is about the best version of ourselves. It's just not stopping at curing disease or preventing. Can we have more Virat Kohlis? Can we have more artists? Can we have more singers? Can there be a personalized doctor, personalized coach for each one of us? So I think those are some of the scenarios we really envision. Having said that, I think the models on how this can be brought together, I think the building blocks are already there. Right. We just spoke about Amazonomics. We talked about Amazon Health Lake, which brings structured and unstructured data. There is Amazon Textract, which we use, which converts data, voice to data. There is also Comprehend, which can understand medical jargon. We think there is already building blocks available today, which can actually bridge the gap between the complementary medicine, traditional medicine, and modern medicine, what we just spoke about. But maybe if Rajiv wants to add the way forward.
Yes, absolutely. So the building blocks are already in place, but I have one question for you, particularly Rajiv. You're, of course, trying out the collaboration, bringing people together, especially now that AyurVAID is an Apollo Hospitals entity. You have people from different fields, medical practitioners, researchers from different fields getting together on a daily basis. In your personal experience, what's the biggest challenge on ground? Because obviously the mindsets have been different for years. The way of thinking, the way of operating have been different for years. The goal is unified, which is to improve patient care. So how are you navigating? What are the big challenges you are navigating on a daily basis?
Well, I think the opportunity is so huge and the need fulfillment gap is so huge that I really don't see a real challenge in approaching the market, number one. So when you look at the market space and the continuum of healthcare demand which is there is space for every type of healthcare player. So what we see is that pure Ayurveda has got a huge play right from primal prevention, secondary prevention, diabetes, arthritis, psoriasis. You take any of the non-communicable systemic diseases. Today, these are multifactorial. And I want to just bring it in the context of AI. When I look at a single cause, single effect paradigm, and then I move to one cause, many effects, right? And one disease with many causes, right? So you have a situation where you have many to many, one to many, cause and effect happening. How do I model in such a case, right? Obviously, AI is the ideal solution for that, right? I'm looking at complex data, huge data, looking at hidden patterns, learning from the data. But then we come to the core issue. When you look at integrating, how does the data that is collected by different healthcare providers, right, in private or public sector, is this data in such silos that they don't talk to each other? The type of data that even I as a particular healthcare provider, as an Ayurveda healthcare provider or integrative health provider, my data is very different from somebody else's data. So these data points don't talk to each other. So when I look at, whether I look at Apollo or I look at Vedanta, everywhere, you would see extremely open-minded physicians and leaders who are coming to this for the simple reason they know that the patient truly needs something more than what only one system can deliver. So in the patients, in that self-enlightened mode, the leaders are coming together to say, we need to work. So I think there are challenges, but we are step by step going, and there are no illusions. This is a path of India showing the path to the world, that there is a different model of healthcare possible.
Right, right. No, wonderful to hear that. Let's also spend a quick minute on the possibilities of the misuse of AI. As we've seen in the past, every new technology obviously hits a peak, it gets mainstream, and then there is potential misuse that happens. In terms of AI for healthcare, what is some of the wisdom that needs to be practiced while harnessing it and ensuring that, you know, we don't misuse it, because here we are literally talking about lives?
So, you know, going beyond very, very micro-specific use cases, as we have seen in the context of diagnosing, let's say, lung cancer, looking at X-ray slides, or, you know, ultrasound reports. One example which I found so heartening in the US, just recording the movement of a child, an autistic spectrum disorder child, from the video, right, what would take 2 months for that to go to an expert and then to get that diagnosed as ASD. Here, an automatic software, you submit it, and the software tells you that this child is potentially at risk and prioritize the care, right? So these kind of applications are fantastic and wonderful. But going back to the point of risk and how to mitigate, unlike the risks of healthcare, of AI in general, which are being touted in terms of the end of the world being prophesied, I think we have to look at healthcare. One of the great advantages today is a total siloization of data. So if I'm looking at a PAN, I can create trouble at a micro level, but to create at a PAN level, we need to look at data unifying, number one. Number two, I would say that all the main players in AI are looking at affirmative regulation, right? So we're talking about precautionary regulation being brought in. As you know, in the US, you know, there are statements to the Senate and the House of Congress on how to regulate. So these players themselves are coming and telling we need regulation. So I see a scenario, I've read about it, people are pushing for a certification mechanism so that any AI-enabled app or AI-enabled platform goes through a process of transparent disclosure of what is a learning model, what is the data set on which it is working, is it a restricted data set? Because one of the biggest risks that we find, we may take an AI model trained on a data set which has nothing to do with we people sitting here, right? Or I take a data set from South India and apply it to a data set, a community in Bihar, it could be completely different populations. So I think these are the risk factors we need to consider. So the overall verdict about AI in healthcare, I believe, is that there are risks, but they are manageable risks. We don't see a doomsday scenario. So we should have better governance.
Right. Okay, better governance for sure. Vikram, now world over, there are obviously thousands of health tech startups that are doing some cutting edge work. At a consumer level, we have wearables of all kinds today. We have things measuring our blood glucose, counting our steps, looking at the food we are eating, recording every step we are taking throughout the day, basically. What's your perspective on creating a sort of an AI blueprint at the back end that sort of unifies all of this data? And, you know, how tough is it to standardize some of these processes, enable interoperability, and really integrate some of this, you know, that's operating in silos? While Rajiv spoke about the benefit of being in silos at this point and, you know, preventing misuse or hacking or all of those things, at a larger level, what sort of a unification is required?
Yeah, that's a big question now for all of us together. But let me just attempt. I think the first thing we all celebrate today is the success of startups and health techs. But the way we do it today is how many unicorns do we have? But is that a right measure? I think we can start looking at the impact. And first thing I think we should really look at, is this going to be a human-centric, holistic health, wellness impact which we can talk about. I think that will change the paradigm, that will change the philosophy itself at the first level. That will bring some level of governance on how the AI blueprint basics and the foundation can be set up. I think the second big thing which we really have today is the ABDM program, which already has several components already included. We can bring in the AI by design right at the design stage. We don't need to sprinkle AI or have it topping. Somewhere we think AI should be part of the dough itself. So that would really actually build the blueprint. We are at the right stage at the right time. Third, I think big advantage we all of us have in India is with the India stack and with the India health stack. There is already a structure which is called DEPA, which is yet to be implemented, but it's going to be about the privacy bill, and the user and the patient is going to own the data. I think those principles are extremely important, and until these regulations are come in, I think there is a whole part which the ecosystem really needs to self-regulate and really comply to ethics. And that's how the basics of the AI blueprint can get started. But I think we really need to form an alliance to go forward on that.
Right, okay, so which brings me to my next question that, Vikram just spoke about building a sort of an alliance and the fact that we are perhaps in the right place at the right time. It is supposed to be India's decade or even India's century, as a lot of global business leaders are saying. With the tech prowess that we have, with the ancient wisdom that we have through Ayush, with the data-led modern medicine research that we have today, how do you envision this sort of does India have the power to make a global medical health alliance which can lead the world? And, what are some of the near or low-hanging fruits or milestones that, all key stakeholders should be aiming at right now?
If you see the fact that last year, the Global Center for Traditional Medicine, which from the WHO got situated in India, it's not for India. The center is to look at such solutions for the rest of the world and to prove the evidence and the efficacy and safety of these systems. If you look at taking AI into the country at large, in addition to ABDM, which today is restricted primarily to tertiary quaternary care. So that's when the problem has come to a peak, right? It doesn't look after, it doesn't look before. If you look at the 150,000 primary health centers, which are proximate to the villages, we heard Dr. From Wonder App, who was Vasco, I think, Dr. Vasco, who was speaking about the Bihar experience. If you look at what data gets collected at the primary health center, if we get AI to work on data, going beyond the 5 NCDs and some maternal simple parameters into a more comprehensive whole person 360-degree data, means all aspects of data, particularly functional data, functional health data. If you were to go beyond purely the biomarkers into the larger body functioning, you have powerful data to determine and predict who's going towards illness. So I think there's a huge opportunity for India to show, and this is completely low-hanging fruit. We have the highest percentage of stunted growth and underweight children growing in particularly some districts of the Bimaru states. But we should bring these solutions to bear. So I want to conclude by telling the government, supported by the private sector, needs a vision as to where we want healthcare to go, healthcare services, leveraging all these technologies. I suspect that there is some effort happening, but a very clearly articulated vision from the government is required, on which different players can tag on and deliver and make India into a major player. And the people who would benefit first would be people at the bottom of the pyramid, right? So I think we have a very good pathway, but I hope that the policymakers will hear us and do something about it.
Right. Okay, so clearly policy push needed for sure. Vikram, how can startups like Minfy add to that? What sort of a unique position are innovative startups like Minfy in to sort of lead this global health alliance?
I think startups like Minfy have a big role to play here because we are closest to the ground where we are seeing this implementation. You saw multiple examples today where we are getting the first feedback from the patients, from the users, what's working, what's not working. There is a big alliance already between policymakers, researchers, academicians, big tech. They have a big role to play, but organizations like ourselves who are actually implementing on the ground have the first pulse, what's working, and we are the voice in some sense. So I think a big role for us in this entire sort of alliance, but it's again, as I say, very early days. We really have to form this blueprint together.
Absolutely, very early days, but great to initiate these conversations. Thank you so much, gentlemen. And of course, with the immense potential that India has in terms of technology, in terms of talent, in terms of youth and the demographic dividend, while it's still early days, like Vikram was saying, for these conversations, it's great that we are taking a step in that direction. Thank you so much for sharing your thoughts with us here today.
Thank you.
Minfy and AWS present AIM 2023 in association with CNBC TV 18.